This is the Western Fair Agriplex, the site of the city's first COVID-19 field hospital. London Health Sciences Centre has set up 144 beds, but it could be expanded to 500 depending on need. The hospital hopes they'll never have to use it.
So our principle, first off and foremost, is that we're going to be building capacity to treat COVID patients in the four walls or the many walls of London Health Sciences Centre. We're standing up, tripling our critical care capacity, so that means more ventilator supports, training of staff to do different work, doctors like Ian working with different teams and so forth to try to build that capacity. Other hospitals are also trying to build their acute care beds so that they can house patients, or treat patients I should say, here as well too. If that is exhausted, and I think this is really an important point, if that capacity gets exhausted, then we would trigger to open a facility like this so that we can provide care for patients. My success point, and what I've told our teams, is the success for this facility is that we build it, we get it ready, and we never use it, okay? But that success point is not something that we can control as London Health Sciences Centre or our physicians. That's really up to what the virus is doing and what our community is doing in terms of social isolation, following the directives from both provincial and federal governments around isolating and staying away from people, and following all of those things to a T. If we need it, we want to have it ready, because we know that if we need it, we're going to need it quickly. But as I said, my goal is to stand this up but never use it. That would be success. The scope of this center is really going to be around treating patients who aren't critically ill. So the critically ill patients are going to be housed in London Health Sciences Centre, and this facility would be used for patients who are on the road to recovery but not ready to go home yet. So low acuity, low needs. We're not going to have a lot of interventions done here. It'll be fairly basic restorative care, perhaps some palliative care as well. But it's not going to be an intensive care unit site. You won't see ventilators here, you won't see all the fancy monitors and so forth here. It's going to be fairly basic care for those people who are getting ready to go home, and we'll help them with that.
Really impressed, inspired by the teamwork put together by so many different people. I mean, this is the people. Another great line was, someone said, you know, we build hospitals, we've done this before. In previous cases, we planned for 10 years, and this time we have 10 days. And that's essentially what's happening, right? And Neil keeps saying it's not going to be pretty. I mean, this, you know, it's not the Ritz-Carlton, but it'll be functional. It'll do what it needs to do. Our job is to be ready, so that at a moment's notice, if we get the order that it's time to move patients, then we're prepared to move patients. But if you wait until you need this space, you're in trouble.
The facility is fitted out for 144 beds for the initial phase. So I'm not sure how much we would expect to see. We're hoping we don't see any at all. Last week, Wednesday.
Okay. Because Dr. Paul was saying he went to the CEO with it 2 Fridays ago. So, so last Wednesday, somebody came to your office and said, hey, here we go.
Correct.
What was the first thing you thought?
Challenging. It's kind of exciting, and wow.
Just wow, yeah.
Just called him and asked him, I said, I need flooring. I need it for 40,000 square feet plus. What do we have available? Where can we get it? And he sourced this out, and within, I would say, a few hours, it was here, and we were laying it down. It's from a field hospital point of view, it's basic with the right infrastructure, and the primary need is to make sure that the patients are taken care of, and we get them back home healthy.